Assalamualaikum everyone. Our next topic of discussion from first aid pathology is granulomatous inflammation. Granulomatous inflammation basically is a form of chronic inflammation in which there is formation of granulomas. Granulomas are basically type of immune cells, collection or cluster of immune cells, primarily macrophages, that are formed to eradicate to wall off certain infections that body cannot eliminate or eradicate. If we see the etiologies, the important ones are the TB, and in cases of non-infectious, sarcoidosis and Crohn diseases are important. If we see the histology, first of all, there will be epithelioid cells. These are the epithelioid cells. They are surrounded by the giant cells, and then they will be surrounded by lymphocytes. Outer layer will be formed by the fibroblasts. So this is a beautiful picture of granuloma, and there are basically two types of granulomas: caseating and non-caseating. In caseating, there will be central necrosis, while in non-caseating there will be no central necrosis, and their examples are important, like caseating is seen in TB and non-caseating is seen in sarcoidosis and Crohn disease. If we see the mechanism, the antigen presenting cell, they present the antigen to the CD4 helper T cells, and then they secrete interleukin 12. Then the CD4 cells are converted into Th1 cells. They secrete interferon gamma. They activate the macrophages. Macrophages secrete cytokines like tumor necrosis factor, and then they form the epithelioid macrophages and the giant cells. This is the basic histology of the granuloma. Epithelioid cells are the most important cells that are seen in granulomas. They are basically macrophages. Then comes the giant cells, and then the lymphocytes and the fibroblasts. If we see the anti-TNF therapy, it is basically, if anti-TNF therapy is given, what will happen is that there will be a disseminated disease, because the granulomas were walling off the causative agent. If we see give anti-TNF therapy, this granuloma, this wall will be break down, and then the infectious agent will spread. This will cause disseminated disease. So it is always recommended to test for latent TB before giving the anti-TNF therapy. And there is also a point that it is associated with hypercalcemia, because in activated macrophages there is increased activity of 1-alpha hydroxylase, which cause increased vitamin D activity. So if we see from here, it is a pattern of chronic inflammation induced by persistent T cell response to certain infections, TB or immune mediated disease or any foreign bodies. They basically wall off a resistant stimulus without completing eradicating or degrading it. There is persistent infection which will lead to fibrosis and organ damage. For example, person has a TB infection, body is unable to remove it. So what will happen is that the body will form a granuloma around the TB infection, so that it will not spread into the body. So basically it is a protective mechanism. And obviously there will be surrounding inflammation around the area, and it is known as granulomatous inflammation. There will be granuloma and associated inflammation. This is the histology showing central necrosis. There will be foci of the epithelioid cells, which are basically activated macrophages with abundant pink cytoplasm. They will be surrounded by lymphocytes and multinucleated giant cells. Giant cells are basically formed by the activated macrophages. When they fuse, they form multinucleated giant cells. In caseating, there will be central necrosis, and in non-caseating, no central necrosis. And caseating is seen in infectious etiologies like TB and fungal, while non-caseating is seen in non-infectious etiologies like sarcoidosis and Crohn disease. This is all the mechanism that we have seen. Infectious, there will be bacterial, fungal, parasitic infections, and the catalase positive organisms seen in the chronic granulomatous disease. While in non-infectious, there will be immune-mediated diseases, vasculitis, and the foreign body. So that was all about the granulomatous inflammation.